Every year, nearly 50% of all pregnancies, totaling to around 121 million each year throughout the world, are unintended. This means that for women and girls affected, the most life-altering reproductive choice is actually no choice at all. Furthermore, over 60% of unintended pregnancies end up in abortion, and an estimated 45% of all abortions are unsafe, causing up to 13% of all maternal deaths. Now, this can be prevented if only access and awareness to contraception, which is our topic for today, is increased worldwide. So, whether you're just curious about different types of contraception or looking to switch to a new method, join us today as we delve into this important topic. Contraception refers to various methods used to prevent pregnancy. It's an important topic for anyone who is sexually active and wants to avoid unintended pregnancies. So first, let's look into the brief history of contraception, which dates back to ancient times. Some of the earliest known forms of contraception includes use of acacia gum, honey, and even crocodile dung inserted in the vagina in ancient Egypt. In ancient Greece, women used natural sponges as a barrier method to prevent getting pregnant. During the Middle Ages, the Catholic Church banned contraception and promoted abstinence as the only acceptable form of birth control. This continued for centuries, until the 18th century, when condoms made of animal intestine were introduced in Europe as a means of preventing pregnancy. In the 19th century, the use of cervical caps and diaphragms became more widespread, and the first intrauterine devices, or IUDs, were developed. Then, the first birth control clinic was opened in the United States, which eventually led to the development of birth control pill in the 1960s. Since then, there have been numerous advancements in contraception, including the development of new hormonal methods such as the patches, vaginal rings, and contraceptive implant. The evolution of contraception over the years has greatly impacted reproductive health and family planning. Today, there are a variety of contraception options available to both men and women. However, according to World Health Organization, an estimated 257 million women who want to avoid pregnancy are not using effective contraception. And where data is available, nearly a quarter of all women are not able to say no to sex. Now, there are a lot of other key factors that also contribute towards unintended pregnancies. Mainly, number one, lack of sexual and reproductive healthcare and information. Number two, contraceptive options that don't suit women's bodies or circumstances. Number three, harmful norms and stigmas surrounding women controlling their own fertility and bodies. This is especially true in the emerging world. Number four, sexual violence. Number five, judgmental attitudes or shaming in health services. Number six, poverty and stalled economic development. And lastly, number seven, gender inequality. All of these factors reflect the pressure society places on women and girls to become mothers. So it's important to acknowledge that an unintended pregnancy is not necessarily a personal failure, but it may be due to the lack of autonomy society allows or the value placed on women's lives. Now, there are also many myths and misconceptions surrounding contraception that can prevent people from using it, such as a belief that contraception is unnatural or that it can cause infertility. It's important to bust these myths, so don't let myths or lack of access hold you back. Talk to your doctor about various methods of contraception available and choose the one that is right for you. Now, let's look at some of the most common contraception options that are available for both men and women and talk about their advantages and disadvantages. Number one, barrier methods. Barrier methods prevents the sperm from reaching the egg by creating a physical barrier between them. Some of the most common barrier methods are condoms, diaphragms, cervical caps, and contraceptive sponges. The advantages of barrier methods are that they are easy to use, widely available, and do not require a prescription. Condoms also is the only form of contraception that also protect against sexually transmitted infections. The disadvantages of barrier methods are that they can reduce sensation during sex and may cause irritation or allergic reaction. They also require consistent and correct use. Number 2, hormonal methods. Hormonal methods work by altering the levels of hormones in a woman's body, preventing ovulation, or by thickening cervical mucus to prevent sperm from reaching the egg. These methods include birth control pills, patches, injections, vaginal rings, and implants. The advantages of hormonal methods are that they are highly effective, convenient, and can provide additional benefits such as regulating menstrual cycles, reducing cramps, and treating acne. The disadvantages are that they require prescription, they may cause side effects such as headache, nausea, and mood changes. And they also do not protect you against sexually transmitted infections. Number 3, intrauterine devices, or more commonly known as IUDs. IUDs are small T-shaped devices that are inserted into the uterus by a healthcare professional. There are 2 types, hormonal and non-hormonal. Hormonal IUDs release progestin, which thickens the cervical mucus and hence prevents ovulation. Non-hormonal IUDs are made of copper, which creates an environment toxic to sperm. The advantages of IUDs are that they are highly effective, long-lasting, and do not require daily attention. The disadvantages, however, is that they require insertion by a healthcare provider. They may cause side effects such as cramping or irregular bleeding, and they also do not protect you against sexually transmitted infections. Number 4, fertility awareness-based methods, or more commonly known as FAMs. FAM methods help you track your menstrual cycle so you'll know when your ovaries release an egg every month, which is also called ovulation. The days near ovulation are your fertile days, when you're most likely to get pregnant. So people use FAMs to prevent pregnancy by avoiding sex or using other birth control methods like condoms on those unsafe fertile days. There are a few different FAM methods that help you track your fertility sign. One of them is the temperature method, where you take your temperature in the morning every day before you get out of the bed. Another one is the cervical mucus method, where you check your cervical mucus or vaginal discharge every day. The third one is the calendar method, where you chart your menstrual cycle on a calendar. According to studies, the effectiveness of FAM methods range from anywhere between 77 to 98%. The FAM methods are most effective if you combine all 3 of these methods. Now, the advantages of FAM methods is that they do not require any medication or devices and can be empowering for women to understand their own bodies. The disadvantages, however, are that they require consistent and accurate tracking and may not be effective for women with irregular cycles. And they also do not protect you against sexually transmitted infections. 5th method is the withdrawal method. The withdrawal method, also known as pulling out, is a form of contraception in which the man withdraws his penis just before ejaculation, and thus preventing sperm from entering the woman's body. The advantages of withdrawal method is that it does not require any medication or devices and can be used spontaneously without advanced planning or preparation. The disadvantages, however, is that it is one of the least effective method of contraception, with a failure rate of around 22%. It requires high level of self-control and timing accuracy, and may cause anxiety or decrease sexual pleasure for some couples. It also does not protect against sexually transmitted infections. And finally, number 6, sterilization. Sterilization is a permanent form of contraception that involves surgical procedures available to both men and women. The advantages is that it's highly effective and permanent. The disadvantages, however, are that it's difficult to reverse, it requires surgery, and again, it does not protect you against sexually transmitted infections. So to conclude today's episode, contraception is a vital component of reproductive health and an important tool for individuals to plan their families. It is crucial for individuals to educate themselves about different methods of contraception, discuss these options with their doctors, and choose the method that best fits their needs and lifestyles. Effective contraception not only prevents unintended pregnancies, but also plays a crucial role in reducing maternal mortality rates, promoting gender equality, and improving overall well-being of individuals and their families.
Thanks for tuning in, everyone. Please like and share this video and subscribe to our channel. Together, let's build a world where sex education is a human right.